The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
Often people don't realize the effects of birth trauma. Whereas a child gets to that point and it's time to go. Your pelvis is maybe misaligned or twisted or torqued and the baby gets stuck. The head up against the pelvic bone, and now the doctor's got to use some force. Suction cups, hands. The average force on a suction cup or when the doctor puts his hands on a baby is somewhere between 50 to 70 pounds. And that baby's only about 9 pounds. So when you put 50 to 70 pounds of pressure, torquing and twisting and gently pulling, gently is the word we hope for, but often it gets stuck and there's more than gently, the baby's neck can get shifted, and that would cause a lot of issues you don't even realize.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey guys, this is Dr. Wall, and I want to do a special introduction to this podcast. This is a vital topic, and I didn't want you to miss it. Raising healthy children in a chronically ill world. We're going to break down how to be healthy before and during pregnancy. We're then going to break down how to raise a healthy child from 0 to 1, and then 1 to 12 and beyond. Stay tuned. You're not going to want to miss this. If you will, I'm going to bring my guest in right away, Dr. Jenny Bush. Dr. Jenny, thank you for being here. Welcome to the show.
Thank you for having me.
You are the founder of the FlowerChild Method, and you need to describe to me and to our listeners what the FlowerChild Method is and how it is so vital.
The FlowerChild Method has been on my heart for years. It's evolved. It's ever evolving into raising a flower child. And when I think about that, I think back into the 70s and these kids that are barefoot and they're playing. And I grew up on a big cattle farm, so that was our life. We played in the creek, probably with too many pesticides now that I think about it.
Less than there are today, I'll bet.
Yes. But I have 3 kids of my own, and I'm always trying to raise a healthy child, or at least as healthy as I can. And that's where the FlowerChild Method has evolved. And it's just teaching parents to get back to the simpler way of life, and also how to detox your children in a safe and effective way from all of the chemicals, pesticides, herbicides, parasites. And then it also talks about my story and the story of my children and what I've went through as a mom myself. Yeah, that's it.
Well, I do know a little of the story. I think maybe that's for a podcast at another day. But the story is great. You need to kind of log in. How can they find information on that? Is this an online website?
Yep. You can go to my website, theflowerchildmethod.com, and it has everything on there. It does have a few products, but the blog is amazing, and it talks about my little guy Lucas and my daughters and a lot of information.
When we talk about unhealthy children or an issue relative, we know that often the pillar of the family is the mom. Not that the dad isn't really vital, but the mom really seems to often have the burden to keep children healthy. And boy, if the child is unhealthy, not only does it just wear on the mom, it can really be difficult on the family. And for sure, it sets the tone for the child's life. A healthy adult often was a healthy child. Raising healthy kids is not easy, but a lot of times we don't realize that raising a healthy kid starts before they're born. So if you don't mind, Dr. Jenny, I know you know a lot of tips. I know in general a couple. I'm going to throw it to you, and maybe I have a couple thoughts. But if you're a mom or a family and you're going to have children or you're pregnant, here's a few things you want to consider either before, during, and not after the pregnancy is over. What would be maybe some things that we'd want to inform them and educate them on?
Yeah, I think what most people don't know, or women, is they're just so excited to get pregnant quickly that they haven't prepped their body for as healthy of a pregnancy as possible. And with our world being so dirty, the chemicals, the food, the water, and then the lack of movement, they get pregnant and then they're growing a human, which is such a miracle. But they don't realize the baby doesn't usually, there's not as many issues with the baby. It's more the mom just depletes everything because her body wasn't prepared or as well prepared. And I've been through it myself. So a few things would be just before pregnancy. Obviously, you could have your labs checked, but more than anything is to clean up your diet, make sure you're moving, get your body healthy, because insulin resistance is such a big issue during pregnancy now. Drinking clean water, and just knowing what you need to do for your path of pregnancy because you're really tired.
I don't think maybe everyone thinks that thought before you get pregnant, but everything you have inside your body is what becomes inside their body. So I think a couple of considerations you should have are your liver and your gut, because whatever is in you is often going to be transferred to them. As you said, often it depletes them of nutrients, essential fatty acids, some of the main things they need. But do you agree that maybe the gut and the liver, are there things that people can do before they start considering this pregnancy to clean that up?
Oh, for sure. I mean, obviously you'd want to be on a good probiotic. You could always do a liver gallbladder flush because gallbladder issues are huge during pregnancy. I can tell you, I have passed, and I had no idea, I passed parasites, I passed dormant Lyme to my children because it goes past through the placenta, and it was also in my breast milk. So if I would have known those things prior to having my children, which most people don't, I would have cleaned them up before I got pregnant.
Yeah, and how do people find that out before that? Because you weren't symptomatic really with those conditions, so was there a way for you to maybe have found that out? Now that people know, we're telling other people to know, how do they find out?
It's really hard to find out about Lyme and parasites, but you have a gut issue or if you have fatigue. And I had been tired since chiropractic school. I know in Ohio I had been bit by a tick. I had the big bullseye rash, so it made sense that I had dormant Lyme. A lot of us do that live in the Midwest. I would say 95% of us have parasitic infections inside of us. Our body is fighting it. That's natural. So you could do quite a few cleanses or just prep your gut into where you're eating healthier. You're decreasing your chemical exposures. You're cleaning your foods better and drinking cleaner water prior to pregnancy, and you'd see big changes.
My advice in that same scenario would be just essential fatty acids in high amounts. If you're a mom, if you're a pregnant mom, you got to realize you're making a human, and their brain's made of fat, and their myelin and their liver need fat for hormone. You need to have extra essential fat. So whatever you have or haven't been taken, double and triple it up during pregnancy. Colicky child, I've treated hundreds of colicky children, and they are all fixable. Sometimes it's through simple adjustments because they had a birth trauma issue or they were pulled or twisted coming through the birth canal. But often it was the mom had a gut issue, and because the mom's gut is the child's gut. That's what the umbilical cord is literally connecting your gut to their gut. And so whatever natural bacteria you have or bad bacteria, if you have yeast, they have yeast. If you don't have any good bacteria, they don't have any good bacteria. If you're overabundant in carbohydrates, you're creating issues. So reduce the carbs, increase essential fatty acids, and take a lot of good probiotics. That's my recommendation. What do you think, Doc?
Yeah, and really increase your protein intake. There's been some controversy on taking liver capsules or eating liver during pregnancy because of the high doses of vitamin A, but that goes into liver and the fatty acids and absorption. It's really, really good for you, and we don't anymore eat a lot of the organ meat. So that would be my recommendation during pregnancy is Heart and Soil, Ancestral Blend, even Force of Nature is a packaged meat where they have like organs blended into them. Those are really, really good for pregnancy, and they help with the absorption with the essential fatty acids too.
Yeah, I mean, thinking about, again, making a human, a lot of protein, muscle, all that stuff has to be used in it. How much protein? Because I had a guest on here a couple of weeks ago, and they said that you would actually look at your body weight and you would need that many grams in protein per day. That could be a lot for some people. Like what would you suggest a mom pregnant would have for protein every day?
I mean, minimum 100 grams.
100 grams.
That's minimum.
I like that round number. All right, 100 grams of protein. All right, well, let's hope that, that goes well. And, we have the pregnancy, everything hopefully is delivered correctly. The one thing you have to realize, I already mentioned it, is that often people don't realize the effects of birth trauma. Whereas a child gets to that point and it's time to go. Your pelvis is maybe misaligned or twisted or torqued, and the baby gets stuck, the head up against the pelvic bone, and now the doctor's got to use some force. Suction cups, hands. The average force on a suction cup, or when the doctor puts his hands on a baby, is somewhere between 50 to 70 pounds. And that baby's only about 9 pounds. So when you put 50 to 70 pounds of pressure, torquing and twisting and gently pulling, gently is the word we hope for, but often it gets stuck and there's more than gently, the baby's neck can get shifted. And that would cause a lot of issues you don't even realize. Ear infections, colicky. When the baby is not comfortable, he will be colicky. That's just telling you there's discomfort and he needs help. And he doesn't need to drive around the block in a car for 17 hours. Don't put him in a vibrating seat on the dryer and say that's fixing him. The baby's telling you he could have a headache, and that easily could be his neck from birth issues where they just twist the neck enough. Even C-sections, they have to actually turn the head backwards and pull it back out through the belly. So if you've had a real easy delivery and no force and no forceps, no suction cup, the doctor didn't have to put his hands on the baby, those are the ones I say don't worry so much about it. But if not, you need to get that baby's neck checked. But if they make it through, which some do without birth trauma, and the pregnancy is normal, there's still a lot of landmines that we run into as we start to now have a child go from 0 up to 1 year old. I always thought that was one of the most vulnerable times for a child and a mom to get a baby on the right road. What can we advise them to do during those times?
Yeah, well, I'll go back to birth really quickly. For the cesarean babies, it may seem a little more simple, but they're some of the most torqued babies that I treat in the office, and that's because they are twisted to be pulled out. Another thing for cesarean babies is they don't get all the bacteria from the vaginal canal, and then they're not squeezed through the vaginal canal, and that's really important to turn on the nervous system. So there's research showing that more children that were born via cesarean have higher hyperactive issues because their sensory and their motor reflex, which is their startle reflex, is higher because it wasn't, when they're being brought into life, decreased by that squeeze on their body. So a good thing you can do it on your own is, in a warm area on your bed, just do a little gentle massage on them every evening for like a week. You could use a little like castor oil, which is good for their skin. And you have to start at the head though, and it's just a nice little massage all down through the toes, fingers, everything. And then as a mom, you definitely want to add a probiotic in and make sure you have that so the baby's getting some, since they didn't get that through your vaginal canal. And for birth trauma, the babies will pull into like a major C twist, and I'm seeing more of it and more latching issues for breastfeeding. And I believe because the babies are bigger, because for our moms during pregnancy, they're more insulin resistant. We're gaining a little more weight. So the babies are larger in general, and we're eating just way more high carbs instead of high protein. So the number one thing to help with that would be more protein in your diet. Dr. Wall, your question was going into 0 to 1 year?
0 to 1 for sure, but
Yep.
that day when they're born and that following couple of weeks is huge. Before you go back past that, there's these blankets I know that are pretty popular where they just wrap these babies up really tight, and it seems to kind of create reduction of colic or things like that. I kind of pictured, I'm wondering, is there a correlation to some of that and maybe the C-section babies, or just that pressure they feel or want, or is that just something that all babies want?
Well, all babies, you're coming out of something you're really small and tight in. So helping manage that startle reflex, like the first month of life, is good. So like the swaddle, I have seen really detrimental issues for other swaddles further than like six weeks of keeping their startle reflex. So their anxiety will be a little harder, or they'll have a harder issue falling into REM sleep. But the biggest thing is they're supposed to have a startle reflex because that's how they tell you if they're scared or something's going on. But you do want to integrate that sooner than later.
All right. Well, moving now past that delivery time, over that next year, what would be any advice or things that we'd hope that baby could either receive or the mother could do?
Okay, so for the mom, once again, let's talk about the fourth trimester. It's never talked about, when you go to your OB, they really don't see you after that. Fourth trimester is you got to put every nutrient back into you. So once again, essential fatty acids, keep up on those, and a lot of protein. Also, you need to rest. You need to stay off your feet for the first couple weeks. There's a reason they say sleep when the baby sleeps. It's to replenish you. And then you got to drink a lot of water and then start moving, working that pelvic floor as soon as possible. For the baby, what I have found is America is awesome, but it's too great. We have all these comfy blankets and we have everything to keep the baby safe and beautiful and calm. And we also have the most chronic illnesses for our children. And I think part of it is because we have everything so comfy and safe for our babies. What I mean is your baby needs tummy time. You got to lay your baby down. And if it cries, it's okay. Sit right by it, rub its back. But every week is 5 minutes of tummy time a day. So at 2 weeks, they got to be on their tummy 10 minutes a day, and you keep moving up. A lot of my moms are like, well, the baby cries, so I just hold them. Well, they're not going to progress through their milestones if you're not doing the tummy time. And then that's huge. A baby has to crawl. So if they're not crawling, a chiropractor really helps with that, or PT. But crawling is an important milestone for their first year of life. And our health system right now is removing milestones. And I always say, go on your mother's intuition. If your child's not speaking and you think they should be, you're probably right. If your baby's not rolling over and the mom thinks they should be, you're right. If your baby's not sleeping as well, like, a mother's intuition is never wrong. And don't let a doctor, chiropractor, anybody, health professional or parent, grandparent tell you differently. A mother's intuition is always correct.
Pain isn't just a physical experience. It's a barrier that keeps you from being your best self. At AFC, we see beyond your current pain. We see your potential to move, work, and live without restrictions. Our personalized approach doesn't just manage pain, it rewrites what's possible for your body. Call us or visit our website. Your breakthrough starts here.
Well, that was a lot of great information, and if there was anything I could add to it, it would be just the urgency to understand a few things that she mentioned. The tummy time thing, understanding the health of a baby's spine. We have such a chronic epidemic today of adults who have really bad spines. It's gotten so much worse, even in the 35 years that I've been in practice. And a lot of it goes to this scenario where we think, again, we got to get babies standing, we got to get babies walking, we got to get babies into the next stage. Now, obviously, as she said, there's milestones, but at times we rush them. We put them in these walkers. I'm telling you, I hate these walkers. Mm-hmm. They put them in these bouncy seats. And now you're putting the baby upright in a standing position when their joints and their spine haven't built the strength to stand gravity in an upright position for very long. So if you want to put them in a bouncy or seat for 5 or 10 minutes, no problem. But for an hour, all you're going to do is create horrible posture because their muscles can't stand it. When they're able to stand on their own, then they can be in a walker. When they're able to walk, unfortunately, they can probably be in one of those bouncy seats. But until then, make them crawl. There's 2 benefits of crawling. One is they develop this normal cervical curve in their neck by holding their head up, and the normal curve in their lower back by arching their back and having to figure that out. They develop the strength. And then crawling helps them develop coordination because the brain, the right side of the brain runs the left side of the body. And if you don't go right arm, left arm, right leg, if they don't learn that thing, you don't actually develop this crisscross track that actually is a big part of sports and the ability to be athletic. And everyone wants their kids to be, somewhat coordinated. Let them crawl as long as they want and don't force them into walking. It's not a competition, right?
Definitely not for crawling. And if we go a little deeper medically, there's a huge primitive reflex. If you skip it, it's your ATNR reflex. If you skip that with crawling, you will have detrimental issues with reading comprehension because your right and left brain just do not connect through and fire properly. So ADHD is linked to it, hyperactivity, sleeping disorders, anxiety, depression, and like the biggest one is reading comprehension. You'll find at school they'll read something, they have no idea what they read, and if we go back in their history, a lot of the kids, they didn't crawl, or they were in a seat or a walker. And I understand being a mom and you're busy, even a dad, and you're like, I need to cook dinner. Well, 5 minutes is fine, or 10 minutes is fine. It's just leaving them in there for a long period of time. That's not good. You can't do it. Got to get rid of it.
It really is. I know it feels like you're saving time today, but you're going to pay for it later. Almost every time. I've
100%.
seen so many of these young children that just as you said, didn't crawl. They skipped that stage and boom, bad necks, bad spines, headaches, lots of issues. Simple thing. Let them crawl until they can walk on their own. Don't force them. Don't push them. All right. Yep. Well, let's move on because we're probably a bit overwhelming, I think, you and I, because we're pretty passionate about this.
Yeah.
I've raised 3 kids. You've raised 3 kids. It's been fun. My kids were all born with unique scenarios. They were adopted. There was drugs. There was really bad, horrific things going on. But through these principles, they've been some of the healthiest kids ever, all over the place.
Amazing.
So it can be done, and you aren't born sick. You can develop healthy children. Let's move on. We get past stage 1, year 1, I call it, and they're still doing okay. Now they start walking, then they start riding bikes, and they start doing other things. What would be, let's just jump from 1 all the way that spectrum, big spectrum, 1 to like 12. What do we want to look for there to have healthy kids for a lifetime?
This is where it gets more simple, less complicated. I think the first year it's a little more complicated because you're nervous and there's a lot. Your brain grows 80% in the first 3 years of your life.
Yeah.
So now we go back to more simple, easier focus on what Dr. Wall talks about on his podcast. Proper sleep, clean water, good healthy food, and getting them outside.
Wow. Big one. That's an epidemic right there today.
Getting outside?
Yeah, they're stuck on inside, and I get it. They're gaming, they're podcast, they're on social media, and they're entertained inside. So why go outside?
I mean, this morning I worked on a mom. She came into me a month ago, and she said, Dr. Jenny, I know you knew everybody. Do you have a therapist for my 3-year-old? And I said, oh man, first bring him in. Let me see him. What's going on? And she said, he's horribly behaved. He cries all the time. He hits his sister. It's not him. And he's always been more of like a cranky child. And I was like, huh. And I said, well, what are you doing? What do they do during the day? How's their diet? And they actually eat really clean, and they drink clean water, and they live in a healthy home. And they've just opened 2 businesses. And after I talked to them for a few minutes, they're on their screens like 8 hours a day.
Oh my goodness.
And he's 3. So, and like, that's what they're doing. And they weren't going outside. And I go, okay, let's just do 1 hour of screen time a day. Let's cut it down. You can't just remove a cold turkey because they freak out, but let's cut it down. And then let's get him outside playing. Make sure her pool is fenced off because her and I had talked about that worry. And she came in today. This has been a month. She was crying. She said, we now have TV only on Saturdays. No screens in the house completely. And on this past Saturday, she offered them TV, and they said no and wanted to go outside to play.
Wow.
And her child is a different child.
I'm telling you,
Yeah.
This is almost our plead to you. I know it's hard. I know it's socially almost unacceptable to remove those things, but it's survival now. Just when I grew up, my mom would put us outside, lock the door.
Yeah.
It's like, you're not coming in for a couple hours.
Can't
just get
do that.
outside, get away from there.
Yeah.
Well, you can put it in the backyard and make sure they stay out there for an hour and just enjoy the sun, enjoying the wind, be outside. All right. Well, we gave you a lot. We can't give you everything. You'll probably never tune in if we do. We're going to move on. We got a call from a mom, and we're going to take that here in just a moment, and we're going to see if we can help her with her children and how she could keep your kids healthy for a lifetime. We'll be right back, and we'll have our call.
After an injury, it can feel like life's on hold, but at AFC, we're here to help you get back to what matters. With personalized injury plans and our expert staff, we don't just treat the pain, we guide you back to strength and confidence. Because getting back isn't just about healing, it's about thriving. Call us or visit our website to start your journey today.
All right, we are back at the Unplugged Healthcast. Dr. Wall here, and I have with me one of my favorite people in the world, Dr. Jenny Bush. She is a mom, runs the FlowerChild Method, and she is one of our clinic directors and owners of an AFC Physical Medicine Center. So we have a call on, which I think her name is Shauna. Shauna, is that right? Are you there?
Yes, I'm here. That is right.
Awesome. Well, thank you for your time today and for being on the show. Today we're talking about raising healthy kids in a chronically ill world. It's a little more difficult today than I think our parents maybe had, but who knows? In your world, is there anything that you have for questions for us or concerns that we can help you with?
I do. So my daughter has an intense sports training schedule, really demanding, and I want to know, is there a good way to balance her health, nutrition, and recovery to ensure that she stays strong, avoids burnout, and she gets the right nutrition while keeping up with her training schedule?
And what was it soccer, is that what you said, or what was the sport?
Soccer, yes.
Soccer.
She does soccer.
Gotcha. Any other sports, or is that the main one?
That's it.
Okay. Well, it's without a question a difficult thing, and we have a high, I think, purpose as parents these days to kind of get our kids active, involved in sports, and hopefully excelling in those. So it's a lot of pressure sometimes as a parent. But I'm curious, is this young one ever had health issues as she's been growing up?
No, we are so grateful. She's been super healthy kid.
Awesome. And today, is she dealing with any health issues at the moment?
Growing. She is definitely going through her growth spurt, so she has been feeling more aches and pains, and probably a little bit more on the tired side since she is growing right now.
Got it. All right. Well, in a second, I'm going to just let Dr. Jenny Bush maybe answer the question that you asked, but talking to the audience just for a second, because this is a classic. We kind of took the show up till 0 to 12, and here I think we have a 12-year-old. Is that right, Shauna, that you're talking about?
Yep, she just turned 12 in October.
Got it. And for you listening here, scoliosis is a significant concern for all parents. They get screened in schools, and I can tell you it's just not that good. They miss a ton of it. And if someone's going to normally get scoliosis, it's right here at this age where they start growing. They get these growth spurts. And sometimes the growth spurts can start earlier for gals, I've noticed, and later for some of the young men. But no matter what, if you're getting your children jumping up an inch or so or more a year, they're very prone to have scoliosis. So the minimum thing you need to start off is possibly at least get a really good scoliosis screening by a physician that understands this. Typically, I would say a chiropractic physician, because they're the ones that specialize in understanding the posture. And I'm not saying an x-ray, but if there's any sign of a curvature at this age, maybe just one simple A to P x-ray to make sure there isn't a curve going on, and then keep a real eye on it as they go. Scoliosis is treatable. We reverse it in our clinic all the time, even in older individuals. And the earlier we catch that, the faster we can reverse, stop, stabilize it, make sure it doesn't progress into a significant health issue. But that really wasn't Shauna's question. Dr. Jenny, what would you say to maybe the question, if you remember what it is that she asked us?
I do. So, Shauna, for your little one, or young lady, I guess we would say, the most important thing I'm finding with the athletes, especially girls around that age, because they're getting close to their menstrual cycle, is, once again, increasing protein. If they're not big eaters at that time, or they're not eating much lunch, make sure you're doing a liver capsule, or add in, you could even do like a prenatal, which sounds a little weird, but high doses of vitamin A and different vitamins to make sure they're getting enough iron in their diet. We don't want to add iron into at their age. It's really not safe, but we want to make sure they're getting enough protein that adds for the iron. For growing pains, if she has a really, really strenuous soccer regimen, you can use magnesium oil. There's good sprays, and you can put it on her legs, arms, and it helps with sleep too, even down the spine. If she's complaining of a lot of back tightness, that leads into what Dr. Wall was talking about with scoliosis. I had scoliosis. It's part of the reason I became a chiropractor. I wish my parents would have known when I was in high school and middle school, because I did have back issues and postural issues, but they didn't take me to see a chiropractor. So that would have been huge for me for my future. Also, sleep, making sure she's getting at least 8 to 10 hours of sleep a night, which might be hard if practice is late. And if she's not able to get that many hours of sleep, make sure there's no like cell phone right before bed, and no TV right before bed, because she won't fall into her REM at least 2 hours past having a blue light in her face. If you have a red light, that does help, and you could put that on her before bed, and that would help her fall into sleep quicker. Yeah.
Okay, well, those are some simple ones for sure, and they're not that hard to consider. A lot of these kids at that age, they play these high-level sports, and I don't see that they actually go through warm-up routines often, or stretch routines. Maybe if they're in high-level clubs, but some of these just maybe public school systems, or some of these scenarios where they're just kind of going out and playing. If they don't stretch out, they can still pull and tear things just like adults can.
100%. And it's an issue even in elite clubs.
Is it?
Yeah, they don't have to stretch at all, barely.
Yeah, a lot of these kids have phenomenal potential, but they just never make it because of just simple things like injuries that could have been prevented with maybe stretching. And again, or just making sure their spine and their joints are healthy. If I'm talking soccer, I'd say for young gals, and young men have similar problems, but the sports seemingly different. There's 3 sports that I always heard stories time and time again. Man, I have a back problem. Okay, as a young girl, did you play sports? Oh yeah, which sports? It was either gymnastics, dancer or cheer, or soccer.
Yep.
And for soccer, the thing that is an issue is the neck, and it's because of those headers. They actually do a practice. I think they do like 50 headers a day or something like that.
Yeah, once they get up to high school, they feel it's safe.
Is that where it is?
Yeah.
Did you agree with that?
They can start heading the ball in middle school, but they don't do a practice of learning how to even do it properly, which is crazy, until high school. And no, it's not safe. I mean, they're not taught how to do it the right way. And then another thing is they sit all day at school, and then they go out and they're playing highly competitive soccer 4 to 5 nights a week.
Are there stretches that a kid should do that most kids aren't doing? I mean, I think bridging is something all adults should do because of all the sitting we do, the bridge techniques or bridge stretching. What about kids? Is there anything specific you tell them?
For sure for soccer is loosening up their hips and getting deeper into their glutes. That comes from ankle to knee to hip back into the glute. And like you could Google or look up proper soccer stretches for glute exercises or hips, but since their hips are always turned out, they really have to work on that, or you're going to have an ACL issue.
All right. Well, Shauna, we're going to wrap up the call, but I'll give you one last thing. If your daughter or daughter's playing soccer, your head was not meant to be an appendage, right? That was your arms and your hands. So when we use our head as an appendage, the upper neck usually gets jacked up. The way you know that is a kid's not always going to have neck pain. They'll have headaches. They'll have sinus issues, sometimes TMJ or earaches, or things, even some dizziness or vertigo or ring in the ears. So look for those type of signs. If the daughters or the kids are saying that, they don't need ibuprofen. They need their neck looked at, and it's so easy. As a chiropractic physician, I love treating kids. It was the most fun thing I ever did because it only took like one treatment. We as adults go in and we have had problems for 20 years and we wonder why the chiropractor has us coming for a month or so. Well, bring your kids in early. I'm telling you, it's 1 or 2 treatments. It's the simplest thing I've ever done. It's easy, it's simple, it's cheap, and it's much easier on their gallbladder and their liver than ibuprofen and Advil, which kids shouldn't be doing. But anyway, Shauna, thank you for your time. I hope we brought you some value. We'll let you go. We appreciate you.
Thank you for taking my call.
All right. Well, Doc, we're going to wrap this thing up here. I know we've given them more information probably than they'll remember, and hopefully they're still engaged listening in. But is there any last information, last advice? How about this one? Because I think we've spent a lot of time with the kids, maybe just a few minutes on how does a mom survive the The biomechanical stress of pregnancy and raising and delivering children. That one I see is almost the number one cause of lower back problems in women who have had children.
Oh, yeah, and moms put themselves last.
They do.
Every time, all the time. It goes back also to just simple movement. If you are with your kids, move on the floor with them, crawl with them, try to get that movement through your body. Don't just sit and then go lay down, right? We got to get movement. The biggest, most impactful will probably be get outside yourself. Go outside, ground yourself. That's huge. Pelvic floor weakness is real. You have to rebuild it every time, every pregnancy.
How do they do that, though? Because that sounds difficult to me.
Okay.
What are the exercises? Give them two exercises they can do to kind of help their pelvic floor, which
okay.
You can't see it.
Yep. You can feel it because
feel it.
when you jump on a trampoline,
Okay.
Yep, you tinkle. Okay, so 2 exercises. Glute bridge is really, really good, and a dead bug exercise. You're going to have to look them up. They're all Pilates movement or yoga movement. They're super simple, 2 to 3 minutes a day. And then get on the floor afterwards, get your knees up against the wall at a 90-degree angle, and lay and let your spine rest against the floor. If you do those things, you will get activation through your spine and pelvic floor. You can obviously do a lot more. Chiropractic is huge, checking pubic bone, making sure pelvis is articulating properly. But you got to work your pelvic floor because it's torn apart after having babies.
All right, moms. Well, here you go. Here's the thought you got to say. You're in the airplane, right? We have some turbulence, pressure changes, and the mask drops. What do? Remember, put the mask on you first and then the little ones. So stop putting their health above yours because you got to be there for many years to take care of them. If I had one bit of advice, there's a very little possibility that your pelvis is going to go from this one position, open wide enough to have a baby come, go back to its normal position, and then be normal and healthy again. Get your pelvis checked, get an x-ray of your pelvis, have a chiropractor look at that because that is so easy to fix after pregnancy. But if you wait for 6 to 7 weeks, your pelvic ligaments have all tightened back up and your pelvis is now going to be twisted probably in the wrong position for the rest of your life. Not to say unless you can get it fixed, but it's much easier to get it fixed right after pregnancy. All right. Well, Doc, did I miss anything? I hate to keep dragging on here, but
no, that was a lot. We went through a lot of information.
We did more than they need, more than they want, more than they'll probably be able to remember. All right. Well, if you want more information, you can go to drkevinwall.com. If you want to be a call on the show, go there, leave a message. You can leave a message on a voicemail that we'll play in the show and answer it. You can text a message on there. You can actually just give us a message. You can be a caller on the show. But if you got any value out of this, would you please do me a favor? Hit the follow button, subscribe, share. Give us a 5-star review. It helps the algorithm. We got some great guests coming on. We got Dr. Patrick Flynn as a guest coming on. If you know anything about him, he's going to be on our show pretty soon. We got some other pretty cool guests that are going to be here bringing value, helping you unplug from the chronic illness that is taking the fun out of your life. So we'll see you on the next episode of the Unplugged Healthcast. This is Dr. Wall and
Dr. Jenny.
We're signing out. Be blessed. Be healthy. We'll see you soon.